The Human Sciences Research Council is calling for regular training of healthcare workers on monitoring medical effects of tuberculosis drugs. The research body released results on its adverse event reporting study in drug-resistant tuberculosis facilities. It found, among other things, that health professionals often struggle to translate their knowledge into action. Now, TB remains the leading underlying cause of death in the country, according to Stats SA. Let's chat more about this with Dr. Razia Gaida from the Human Sciences Research Council. Doc, good morning, and thanks so much for your time. So to make sense of all the medical speak for us, firstly, when you were looking at adverse event reporting in drug-resistant TB facilities, what were you looking at exactly in layman's terms? What were you looking for?
Good morning. Adverse event reporting is part of a process that we call pharmacovigilance. So pharmacovigilance, if you break it up, it literally means keeping a watch over medicines. In this way, we're actually talking about the safety of your medications and the adverse drug reactions that they can cause. So what we want is for these drug reactions to be recorded and then forwarded to a regulatory body, for example, your National Pharmacovigilance Centre in South Africa, or SAHPRA, which is your South African Health Products Regulatory Authority. What they do with the information that they get from healthcare professionals is that they attempt to do signal detection and causality linkages, which means that they try and understand whether or not a particular adverse drug reaction is caused by a particular drug.
Okay, so among other things, you found that health professionals struggle to translate their knowledge into action. What's happening there? What is the problem?
So the study actually found that healthcare professionals have very good knowledge of the commonly seen adverse drug reactions that are associated with your medication that's used to treat drug-resistant TB. So while your adverse drug reactions might actually be recorded in your medical records, this information is then not getting out of the records onto the adverse event forms and to the regulatory bodies where they need to be in order for this data analysis process to occur. So while the knowledge is good, we need to get that behavior very much part of the healthcare professional, very much part of their daily activities and general patient examination so that we can get this data analysis going.
So what else among your findings is of great concern to you at the moment? The healthcare professionals are at a little bit of a loss sometimes as to who is responsible for completing these adverse event report forms. And fact of it is, any healthcare professional is able to complete it, including yourself as the consumer or the patient. So these report forms will then go to, as I mentioned, a regulatory body, but we need to ensure that all healthcare professionals are empowered in order to complete these forms so that the burden is not sitting on a few individuals. I suppose, any layman out there, Razia, might wonder, okay, so it's a form, but, how does it actually affect the actual treatment? What impact is this having on patients who are the important ones here?
Yeah. The ultimate point of pharmacovigilance is to ensure patient safety. So we want to make sure that patients are being prescribed medications that are not going to be causing intolerable adverse drug reactions for them so that they are able to complete their treatment with as little interruption and as little discomfort as possible. So at the end of it, it is all about patient safety. It is about patient comfort. We want to try and prevent adverse drug reactions when we prescribe them as far as possible. And we want to be able to almost predict, in a sense, if they're going to happen so that we can try and prevent them and mitigate them as far as possible.
Could this possibly...
So it's about patient safety.
Could this possibly have played a part then in the high numbers of TB cases that we're seeing, the deaths that we see in South Africa because of this, or not really?
In terms of drug-resistant TB, there is currently a pretty low positive treatment outcome rate. You're looking at about 54 to 58% for your drug-resistant TBs. So while there are a lot of factors that play a role in why patients do not maybe complete their treatment or why there is a negative treatment outcome, we definitely cannot discount the fact that adverse drug reactions is one of those reasons.
And why would they not have received the necessary training so far already, Doc? I mean, why would it take you to have to go and look at this to come up with suggestions now that they need the ongoing training? Why was this not done anyway?
I think training has been done. I think the high staff turnover rates are a bit challenging with regards to the frequency of training. So perhaps by the time you do another training or a refresher course, you've got an entirely new staff complement that you're dealing with. I think also perhaps the people who are doing the training need to diversify a little bit and bring on maybe outsource trainings as well, and not have it rely on a central body.
Okay, and are there any particular parts of the country that where you see this happening more? Is it any particular provinces that you've managed to break this down into?
We covered all of the provinces in the study, and while some of them had more participants than others, just simply because of the sizes of the facilities that you're looking at, I can't say that the results differed significantly between the provinces, no.
All right. And dealing with COVID-19, how is that likely to set things back or impact now what you need to do in this sector?
Pharmacovigilance is something that is applied actually to every disease state. This particular study that we did focused purely on drug-resistant TB, but it is applicable to everything and to every drug, including your herbal medications, over-the-counter medications, etc. So in the case of COVID, even though we don't have any registered medication or confirmed treatments as yet, there is a lot of promise that's shown with your dexamethasone and your remdesivir. But pharmacovigilance becomes very important here, because we need to know if the treatments that we're currently giving our patients is doing more harm than good. Also, in the case of tuberculosis itself, it was found that a concurrent TB infection does not really increase a patient's risk of a negative outcome with COVID as much as we initially thought it might, or the concern that we had. It actually turns out that your diabetes and your older age, particularly those people who are over the age of 70, are actually at the highest risk of having negative outcomes with COVID. But if in the instance a patient is maybe experiencing very bad adverse drug reactions due to your TB medication, and in the current situation they may be unable to access their healthcare, it could compromise their adherence to the treatment. They might stop taking the medication, resulting in the TB causing irreversible damage to their lungs, which at that point might then make them more vulnerable to COVID because of the extensive damage to the respiratory system.
Thanks very much for your time there, Dr. Raisa Gaida, just updating us on what's happening. We can't forget about other serious illnesses as we deal with this pandemic. Still coming up.